to On Deck at the California Healthcare Foundation. I'm here on the deck with Betsy Imholz from Consumers Union. Betsy, welcome to On Deck.
Thanks so much. Great to be here.
We're talking about outpatient surgery centers or ambulatory surgery centers. Why have these surgery centers become so prevalent in California?
Well, there's several things fueling that growth of outpatient surgeries. One is technological advances that have made procedures more easily done more quickly. Another factor is a greater focus on the healthcare system cost and containing that cost, and the idea is that outpatient surgeries can be less expensive. Another thing fueling it is that hospitals and doctors have both seen these as, frankly, big revenue streams. In 2013, the foundation reported that there were over 1 million procedures performed in 2007 alone at these centers, and we know that they're growing in number, so it's probably a lot more than that now.
What are some of the different settings that constitute outpatient surgery centers?
Yeah, there's a range of different sites that come under that umbrella of outpatient surgery centers. So we've got on-site at hospitals, they're outpatient centers. We've got freestanding centers that are associated with hospitals and owned by them. And then there are actually just freestanding independent centers that are owned either by a doctor or a group of doctors or other investors. But many of them perform a whole range of services, from very routine colonoscopies, for example, to much more complex procedures.
The foundation is releasing a report about the regulatory oversight of ambulatory surgery centers. Can you give us a little sense of who regulates these surgery centers and how they might differ depending on the location?
This is a big issue in California, a big problem. The regulatory oversight and the standards vary according to the site and the ownership model, including whether a facility seeks federal funding like Medi-Cal or Medicare funding. If they seek that federal funding, the California Department of Public Health oversees them. If they don't seek federal funding, for example, if they're physician-owned, the Medical Board of California oversees them. But it doesn't really regulate them. What the Medical Board does is it approves 5 different accrediting bodies. Those are private bodies, not government entities, so they don't have funding authority. And those 5 bodies oversee the outpatient centers. The problem is that those 5 bodies each have their own standards, and they're not consistent, their own definitions. And so that makes it very difficult to get consistent data about what's going on at these centers. As an example, some of the accreditors one year one of them found 14% of the facilities in their purview had deficiencies. Another 2 accreditors that same period found 58% of their facilities had deficiencies. And it makes it very difficult for consumers to compare among facilities as well as to compare outpatient surgery centers with hospitals, because we just don't have the data.
What would Consumers Union like to see happen to make this more uniform?
We really would love to see one website with comparable data for consumers and the public to just go and check out and compare amongst facilities and between those facilities and hospitals, but we just don't have it yet. If you have a problem at one of those centers, in addition, you should report it to the Medical Board of California, because that's the only way we're going to keep on top of what's going on at them.
Is there any indication that you have that there are certain types of facilities that are less safe than others?
The problem, Steve, is that we really just don't have the data to make those kinds of judgments. The situation in California is pretty dire at the moment, in the sense that we have a real dearth of safety and quality information about outpatient surgery centers, and we need it to determine their efficiency and their quality and whether they're the best place to go or not.
The California Healthcare Foundation is going to be coming out with a new report on ambulatory surgery centers, and we also have a data visualization which shows what information is available from the different accreditation bodies. And you can look for that at chcf.org/outpatient surgery. Betsy, thank you very much.
Thanks so much.